Hey, welcome to my channel. My name is Ashley, and today I'm going to be telling you all about my laparoscopic myomectomy. I'm going to share with you some things that I bought, the actual procedure from start to finish, how that went for me, and I'm going to talk about my recovery, and at the end I'm going to show you pictures of everything they took out and things that they fixed. I'm excited. Let's get started. I posted a little snippet on TikTok that is rendering a lot of great questions about my laparoscopic myomectomy. I ended up having a very interesting recovery, and I think that got some good dialogue going. I want to help anyone who is about to have this procedure manage our expectations. I also want to help you with certain things you may need and things that people might say you need. I want to give you the real about this procedure, okay? But specifically a laparoscopic myomectomy, not an open myomectomy. I did not have an open myomectomy. They are very, very different. And the recovery process is very, very different for both. So let's get into it. Let's talk about why I wanted to have a laparoscopic myomectomy and why I needed it. I didn't just want it. I needed a laparoscopic myomectomy because there was something inside of my reproductive organs that was causing me to bleed more weeks out of a month than not. If you're continuing to bleed, you're losing a lot of blood. I was ending up being more anemic, tired all the time, nails are breaking. It was a lot. I needed my iron back. I needed my red blood cells to stay in my body. No transvaginal ultrasound was showing what was really going on. No HSG test was fully showing what was going on. So they had to go inside and really figure out what the problem was. And I'm glad they did because they found it. Before going in, what we knew is that my tubes were a little abnormal. My right tube was completely normal. My left tube, once we did the HSG, had a hydrosalpinx, meaning the tube was clear all the way through, and then at the very end there was a blockage that caused ballooning. So when they pushed the fluid through, the fluid went through, but since there's nowhere for it to go, it ballooned up like this. So that was one abnormality with my tube. So going into the surgery, my doctor was like, I'm gonna go in and try to fix the end of your tube. I said, great, let's do that, because I do want to have kids. Secondly, I had 3 fibroids. 2 of them we knew we could remove very easily. They were not inside of my muscle. So he was like, that's no problem, I can get that out. The third one I was told was possibly inside of my muscle, and if it was in the muscle, then I would have to have C-sections moving forward. Possibly, that would be most likely the case, because doctors don't want to risk me re-injuring that, re-severing the muscle, hemorrhaging, I can't say that word. Hemorrhaging and anything like that. And for me, I know that my desire is to have an unmedicated birth, so that was kind of a deal breaker for me. My doctor also told me that the location of my uterus that it was not the cause of all of the excessive bleeding. So I was like, okay, if it's not really bothering anything, leave it alone. If you get in there into my uterus during surgery and you realize you can't take it out, just leave it there. That was our plan. Just wanted to put that out there. That was the reason I was having surgery. It was excessive bleeding. They needed to get in there and look. So I had a hysteroscopy. Scope means like look. Hysteroscopy. So they went up through and they looked with a camera to see what they could see. I had a laparoscopic myomectomy to remove the fibroids, and I had a laparoscopic fibrology to fix my tube. 3 things in one. All right, if you have any questions about that, leave them in the comments below. We're gonna move on to things that I bought to help me prepare for the surgery. And then I'm gonna tell you which of these were helpful and which of these were not. First things first, I bought this wedge pillow from Amazon. I use this to help me sleep more elevated. They're going in through your stomach, if you didn't know that. I know before my laparoscopic myomectomy, I thought the incisions were through the vaginal canal. They go in through your stomach. I have 4 incisions where they entered into my body. Since they're going through your muscle, your abdominal muscle is actually severed, so you really can't use them right after surgery. So this came in clutch, I will say. It transforms to have like less of a 90 degree angle, and then you can flap this up and it gives a strong, it just chin checked me. It gives a 90 degree angle. You can lay it like this and have a 90 degree angle going this way. All of these things I'm gonna be showing you are in my Amazon storefront. My favorite, are y'all ready for my favorite thing that I bought? This is the GOAT, okay? This is a pillow. It has a buckle here for this to go around your neck. You can adjust the straps as high or as low as you want them. Here's my favorite part about this entire thing. It has a pocket on this side, a pocket on this side. I kept an ice pack in this pocket right up against my stomach while I was recovering. I would take a nap and pass out, have this ice pack right against my stomach. It was the best thing ever. I think this is meant for food. Baby, I'd be like, babe, can you give me the 3-hour ice pack? Because the one that's meant for your body, that one lasts about an hour. This almost went on to be cold all night long. So I would just tuck this in here like this, nice and cold. put this against my stomach, put this around my neck, and I would go to sleep. You can also strap it in like this if you want to. Let me tell you why this is so effective, okay? If you have any pets at home, which I have 2 little dogs, you see their bowl right there, the girl be eating. My dog loves to walk across me. That's my baby. He loves to just sit on me. His favorite thing to do is lay on my stomach. So we don't need that. Not fresh out of surgery. So that helps me a lot, having this pillow here. They still got to love on me without any fear of them hurting me. Also, when you get in the car from surgery, you need this in your car with you, okay? Why? When you put that seatbelt on, you don't want that seatbelt going across your stomach and across your incisions. So this helped me so much for any car ride after surgery and for pets. And even if I was not in a car, just to have something hold my ice pack against my stomach for me was the best thing ever. This is in my Amazon storefront. Get you one. Whoever invented this, baby, he was light years ahead. Some other things I bought to prepare for surgery were these compression socks. Came in a 3-pack. I only used 2. I only used them once. Probably should have used them more. Compression socks. Another thing that was a huge lifesaver, I just don't know if I was supposed to do this or not, but I just did it because I did it. Your abs are gonna be really weak after surgery. This thing helped me support my abs. This helped me lay down, get up, cough, sneeze. If you have to cough, hold your abs together. Give them some support and cough. If you have to sneeze, hold your abs together. Give them some support and sneeze. Try to support your abs as much as humanly possible. Please give your abs some support because they need it. A belly binder is what they call them. This is also in my Amazon store. This helped me sit back up straight. There was something that was going on in my body right after surgery to where it felt like somebody had a string tied from my belly button to my pelvic bone, but the string was too short. So I felt like this, and I didn't want to be permanently hunched over like this. My ab muscles need to be straight. My posture needs to be straight. So I bought this thing to help with that. I wore this after surgery. I wear it on top of clothes because I don't want to hurt my stomach. I got this step stool to help me get in and out of bed. Lifting your leg up, fun fact, requires your abs. This is also linked to my Amazon. Has a little handle, easy transport. I used a crutch to help me get out of bed by myself. I got to a point where when I stopped screaming from excruciating pain from needing to use the restroom, this helped me a lot, and I got to let him sleep throughout the night. It was more so like, how do I get up? Let me tell you how I got up. When you're laying flat in your bed, you're not gonna realize, or elevated, however you're laying in your bed, you're not gonna realize how much of your abs are needed to throw your legs off the bed, sit up, and get out of bed. What I started to do was use my arms. Get ready to use your arms. The ledge of my bed is on this side. The bathroom's over there, right? So if I'm laying down, I would use this arm to push the bed away from me. Not even using my abs. I would push the bed away from me to roll my body over, right? I would grab the headboard. Thank God it's like a handle. Grab the headboard and yank myself over this way. And then I would grab my crutch, would stay right by my side, to pull myself up. So that's how I would get out of bed to use the restroom. If you have nobody there with you, use your arms. Please use your arms. It is the most helpful thing ever. Use your arms to roll you around. Push the bed away from you, to turn the opposite way. Push the bed away from you, just to move yourself around. It's really helpful. Next up, something I really want to prepare you for. The pain after surgery is not due to incisions. It's due to gas. So during the procedure, they puff your body up with gas so that they can see everything. Because believe it or not, our uterus is not just floating with the tubes out there and our ovaries. Everything's kind of compact. There's fat, there's muscles, there's bowels, there's intestines, bladder. There's so much going on. During surgery, they puff your body up with a lot of gas so they can see everything a lot more accurately and a lot more isolated. Some things to help with gas, because that was the most painful thing after surgery. Not even the incisions, the gas, the gas, the gas. Some things to help: peppermint tea, pure peppermint by Twinings. I wish I had the box, but baby, I ran through them. I had everything for gas. I had gas relief pills. I was chewing these up like some candy for gas. Also for gas, this saved my life. This is a heating pad. This heating pad goes around your back, because my gas pains were in my back. They were in my shoulders. So this goes around your shoulder. This all gets hot up here. There's a little, you can snap it together like that. You can tie it together like this and just sleep. I slept with this on me. This helped so much, y'all. So much for the gas pains, because the gas pains was the most painful thing for the first like week. So, gentle laxative. Okay, one thing that happens after surgery is our bowels kind of slow down. 2 days before surgery, I was taking the gentle laxative to make sure everything was moving through my system. I didn't want anything stuck in there, because during and after surgery, it would just be more stuck because it's even slower than before. Let me kind of talk through my experience with y'all. I had to fast when I got to the hospital. Got to the hospital, filled out all my paperwork, got sent into like a triage-ish room. I get to that room, it's freezing. I have to HIPAA cleanse my body down and do like an antibacterial wipe down. Even though I had to wash with Gold Dial antibacterial soap at home the night before and the morning of. Now, we don't want no infections. I'm fine with that, right? Doing the wipe down. Now I have to get in this gown, and along with the gown, there's a hole to insert a tube, and hot air just came through and warmed me up. Put on my little socks, I put on my little cap thingy, put my hair in a bun as best as I could to prepare like for the doctor to come in and give me all the instructions. I just kind of sat there. My man and my mom were there to support me, and I just kind of sat there and waited for the doctor to come in. My mouth was really dry because I couldn't drink anything past, I think it was 7 a.m. My appointment wasn't until noon, I want to say. And the nurse comes in, hooks me up to IV. She gives me antibiotic orally. I think I took some antibiotic pills. I took a pain pill.
How many of us you see, baby?
Is it two of you? 5 not gross.
A little bit.
You're gross, huh? Where y'all go? What y'all do? She said I got pee fart.
Do you feel like it? Your mouth gonna be dry.
My eyes are crossed. They're crossed.
When I woke up from surgery, they would not let me leave until I peed.
She said I got pee fart.
And I could not pee for the life of me. Even though they, I had the IV and that pushes fluids all throughout your body. But then, and she was about to do a catheter, which would have been really painful. I was halfway asleep, I couldn't wake up. I was saying my throat was hurting. They got me all kinds of juices. They also got me a hot tea. I don't remember this at all. My man told me this. They were trying to get me to pee. The nurse comes in and does a bladder scan. She realized there was nothing in my bladder. Ain't that what I said? I said, I can't pee, I can't pee. If I could have peed, I would have peed. So anyways, they let me go home. Got my pillow on me. I'm drugged up. I get home. First night I just sleep. I had food. I think I had like Chick-fil-A. I remember waking up like drugged up, eating fries and nuggets in bed and like passing back out. So I was just really in and out of it the first night. Hey y'all, I'm currently 1 day post-op. My throat is on fire. I have cough drops in my mouth. I can't get comfortable in bed. This wedge pillow is alright, but I keep sliding down because it's so erect. It hurts so bad. My stomach pain is like a 9 out of 10. It's more like the entry sites, like the scar, the sites where they cut me open. It's more like those things are burning, and then like the inside part of my stomach feels like constipation pains, basically. I've taken my stool softeners and they have not worked yet. I got my heating pad that goes around my shoulder. This was like 20 out of 10 pain. The shoulder gas, the gas in your body. I thought it was painful when I would get up to go to the bathroom. My bladder was pushing on my uterus. It just got operated on. I thought that was a pain. I woke up in the middle of the night screaming on like 3 different occasions. Went to the bathroom. As soon as I pee, no more pain. It's only when my bladder is full of pee and I go to the bathroom. It is the most excruciating thing ever. I thought that was bad. Until my shoulder pain from the gas kicked in. Ciao. I've been sleeping off and on all day long. Granted, I was up on the hour every hour last night because I had to pee. But during the day, I've been taking cat naps all day because of the drugs they have me on, the painkillers. So that's my little update. I got my procedure done at 1 yesterday. It's like 7 p.m. right now. So it's been a little over 24 hours. I will check back in with y'all a little bit later. Okay. Some things I got for post-op. I have healing ointment. I have these silicone scar sheets. Let me tell you something.
Wait. Let me tell you something. All right. Let me tell you something.
Do not, I can't stress this. Let me get closer. Do not put these on your body if you still have stitches exposed outside of your body. I mean, I have 4 scars. I have 1, I have 2. I don't know if you can see that on my belly button. 3 and 4. So this one is the weirdest healing one. You can see bandage marks around it because my stitches were outside of my body on this one. Right here, I had a stitch just sticking out for the longest time. The rest of them were internally stitched. So once I was like 3, 4 weeks, 5 weeks healed, I said, let me finally use my silicone sheets. I put these on all of them. When I took it off, it pulled my stitch out a little bit from the right one. So it's healing a little funny. There was glue on top of my incisions. You're allowed to wash that as much as you want. 2 weeks post-op, I went back to my doctor. He took all the glue off, like just ripped it off. Didn't hurt, thankfully. And I asked him about why one of my stitches was just poking out. He just made it sound like it was normal. Hydrominos, you have to stay hydrated after surgery. I had this procedure done on a Thursday. Saturday morning, I called my doctor. His emergency line rang because I called the surgery recovery. He's on call, right? So I woke this man up. I could hear in his voice that I woke him up. I was like, hey, I'm peeing, like I wiped and there's green discharge. I want to make sure I don't have an infection. He was like, no, you shouldn't have an infection. You should be fine. I was like, okay, I'm freaking out because why is it green? He was like, no, you took an oral antibiotic. We gave you antibiotic in your IV. There's no way you have an infection. I can tell I woke this man up. Later on in the day, he calls me back, maybe 2 p.m. and he goes, oh, Ashley, I didn't even think about it. I meant to tell you because I went in and fixed your fallopian tube, we had to push some dye through your tubes like a HSG all over again to make sure your tube was open. Let's talk about my fallopian tube. I shared with y'all my HSG experience, right? And I told you I had a really weird situation with my fallopian tube. My left fallopian tube was actually stuck to my ovary. Don't ask me how that happened. The very end of the tubes are actually supposed to be free. They're not connected. My friends got me this pillow during my recovery and it's like my favorite thing. Oh, it's so cute. In real life, our ovary, this little round thing, is not connected to our tubes. Our tubes, however, are connected to our uterus. My tube was in real life stuck to my ovary. It's not supposed to be. So that's what was causing the hydrosalpinx, the balloon, was they were trying to push the dye through and it ballooned up right here because it was stuck here. So the doctor was like, oh, it's just dye. Cool, I'll let it go. And nobody's gonna tell you this, but I'm gonna tell you this. When you are recovering, it is hard to cough, it is hard to sneeze. There's a deficit in your abs. We need our abs to cough. We need our abs to sit up straight. We need our abs to lay ourselves back, to sit ourselves up. You're not gonna realize how often you use your abs until you can't use them like you usually do. So this surgery was very humbling in that aspect of like, I almost got depressed because I couldn't use my abs. I'm not gonna lie to y'all. Laughing hurt, sneezing hurt, like couldn't cough for a while, like couldn't cough. Yes, I ended up going to the ER about 4 days post-op because I couldn't cough. I like had an extreme shortness of breath, like breathing in hurt, like that hurt really bad in the left side of my chest. So I was terrified that a blood clot had gotten into my lung. I went to the ER, they did some tests, they did an MRI, took my blood. They said in my blood, they said there was a marker for a blood clot in my blood, meaning there's a possibility that there was one there. That's terrifying. That is nerve-wracking. After they said that, they laid me down flat. I already can't breathe. They laid me down flat to get into the MRI machine, but I lay down flat. I'm going into the machine, out of the machine, in the machine, out of the machine. I am post-op. Also, I can't breathe. So I kind of had a panic attack because I couldn't breathe. I literally felt like I was suffocating. I felt like an elephant was sitting on my chest. We go through all of these tests. They're like, you don't have a blood clot, you do have a sinus infection. So they put me on antibiotics, great. After we got past the coughing thing, I learned how to cough. I started bracing my stomach and just coughing. My lungs felt 20 times better. So allow yourself to cough, don't just not cough. A week post-op until Leon went to go play basketball. Not like 5-on-5, like an actual basketball game. It was like we played horse or something like that. And I remember like lifting up my stomach and shooting. Certain things kind of hurt and I was like, ooh, I probably did too much. The week after that, I had the most excruciating pain of my life. And it was like right in my belly button. I felt like somebody was stabbing me and turning a knife. I didn't know how to explain that. It also felt like gas pain, but it was like right under my belly button and it was so extreme. Like nothing helped that but time. No Gas X, no laxative, no pure peppermint, like nothing helped that but time. That was my experience. I hope that helped prepare you mentally, supplies wise. I'm gonna show you some pictures as well. Oh wow, more pictures. Okay. So, I couldn't tell what was what. Oh, they figured out what was making me bleed because they didn't know at first. They found 2 polyps in my uterus. So this is what the polyps looked like. This is once they cleaned them out. Polyps, no polyps. 2 polyps in my uterus, they removed them. My left tube was stuck to my ovaries. This is my left tube. You can see that it's stuck. I don't think he was saying you really can't see what it looks like when it was free, but that's my left tube. It says left tube right there. They found a tiny dot of endometrial tissue on my ovary and removed it. It's my ovary? Well, the whole white thing is my ovary. It's a tiny dot of endometrial tissue they removed. This is a fibroid they took out. Boom, bada bing, bada boom. That's so cool. I think that's what it looked like before they removed it. You can see it under the skin. That's after they took it out. He said this is my left tube repaired. You can't see nothing but blood on that one, sorry. Oh, I guess this is another polyp. Baby, I don't know what that is. It don't look right. It just say polyp. I'm just showing y'all pictures because when they showed me these, I was like, sir, please explain because I don't know what y'all talking about. But he explained them in my post-op appointment, my 2-week post-op. He started showing me everything. So that was it. They found 2 different polyps in my uterus. They fixed my tube and they got rid of 2 fibroids. They also found another fibroid and I think they took that one out. So they took 3 fibroids out and the one that's left is the one, that's the fibroid that's left and that's the one that's not bothering anything. But if I take it out, I would have to have a cesarean birth, which I don't want. So I opted to keep them in there. And I'm gonna do a bunch of different lifestyle changes, remedies, diet changes, and things like that to try to help and shrink it. And I'll keep y'all posted on that. If you have any questions about anything I said today, anything I showed, leave them down in the comment section below. Again, I have every piece of equipment that I've used today in my description box below. It is in my Amazon storefront. I've made it nice and organized for y'all to find everything that I bought. And yeah, I hope this video helped you. I hope it prepared you. I hope it eased your nerves or managed your expectations. And if you're not subscribed to my channel, go ahead and subscribe. It's free. I create a bunch of childbirth education videos as well as reproductive health videos, hormone balancing videos, just a lot of stuff for my girlies. Well, that's it. Thank you so much for watching and I'll catch you in the next video. Bye.